Do you know the full scope of a physical therapist? Hi, I'm Dr. Marcy, a board-certified clinical physical therapist with a doctorate in physical therapy. I also hold a certificate in functional nutrition, a certificate in functional medicine practitioner, a certificate in functional epigenetics, and a certificate in food as medicine, and I'm working towards a advanced certification after completing a certificate in hypnosis, and working towards a certificate in longevity research and longevity medicine. Every couple of years, pretty much every state goes through what's called a sunset review of practice acts for different medical providers. And in my state, there's currently a sunset review happening for the Physical Therapy Practice Act. And in the Practice Act, they are specifically adding language that says that a physical therapist may discuss the benefits, risks, and potential adverse effects of prescribed and over-the-counter medications that may affect the patient's client's physical therapy plan of care and other health. Part of that is because physical therapists go through pharmacological training, and then in some of our advanced training that we go through post-graduate school, we continue to talk about the pharmacological impacts of what's happening with our clients. It's also really important for us to be able to say when a client gives us their medication list, hey, have you talked to either the pharmacist or the prescribing physician and made sure that they know everything you're taking, because these two interact and could be creating some of your problem. It often happens with patients who show up in my office with vertigo. It's pretty common as well to see this happen with I suddenly developed tendonitis and have no idea why, because I wasn't doing anything different and I did not injure myself. People to know whether or not they have specific genetic markers that might mean that a statin drug creates an autoimmune disorder for them. A very common side effect of statin drugs is dystonia, particularly in the hands, and also having tendonitis in the elbows and in the hands. It's also common to have pain in the joints of the upper extremities with the statin drug. So if you're a physical therapist and your client comes in with statin medication on board and they are presenting with bilateral upper extremity pain, you may want to know if you can actually help them or if you need a medication change, and then you have to communicate with the physician. And for the first time ever, that's being included in my Practice Act. And I'm kind of excited about it. Because while I've known this stuff for over a decade, I always had to say, it might be a good idea to have a conversation with either your pharmacist or your prescribing physician about how these drugs might be affecting you. And now I get to actually tell them, this is how this might be affecting you and why we might want to request a medication change. So for all of the people on this app who are saying that I don't know what I'm talking about and that I don't have any business talking about it, my Practice Act will say different in less than a month.